Everybody, my name is Dr. Justine Blainey and I'm with Dr. Udani, and we're going to learn more about naturopathy. So I'm the patient and Dr. Udani is my doctor, and we're going to go about how does a naturopathic appointment, what happens, how does it help you, what are some of the treatments?
Yes, thank you. Thank you, Dr. Justine, for being my lovely patient model. So hi, everyone. So today we're going to go over basically an example of what a naturopathic visit is going to be like. So basically it starts off with a concern that the patient comes in with today, and then we're going to do questions, and then I'm going to show you some of my techniques that I do, including cupping and acupuncture as well. So for those of you that don't know what acupuncture is, as a naturopath, I am registered to perform acupuncture in Ontario, and it's really useful for a lot of pain issues and also stress and relaxation and things like that too. And the needles are single use only, and they're all sterilized, so you can get to see my setup as well. And then we use that a lot for pain management. Then cupping is where we use little silicone cups, and that really help with loosening up the muscle tension. So sometimes it can leave a red mark, but that's all normal. It just fades away with time, and it just kind of lets us know that it's really working too. So let's start off with the intake. So Dr. Justine, what are you coming in with today?
My left neck, so I did get hit playing hockey, so I can't turn my head all the way left,
Okay.
and it kind of catches. It's tight on the left side of my neck.
On the left side of the neck. Okay. And when did this happen?
Just a couple weeks ago.
A couple weeks ago. Okay. Would you say the pain is getting better or worse?
It is getting better. Yeah, but I do get some numbness in my left hand.
Okay, gotcha. All right, and has anything helped recently with the pain?
If I do heat and when I get adjusted, that has helped.
Okay, perfect. It helps. Okay, and you said it's hard for you to turn the neck.
Turn to the left.
To the left, okay.
Turn and laterally flex to like bend my neck.
Okay, I see. So I'm probably gonna do some range of motion, and then just kind of feel around the muscles to make sure they're not super tight, and then we will do some other stuff. Okay.
And I have noticed when I've been to a naturopath and fast is it also helps things like digestion or with asthma or if I had headaches or migraines. But at this time I don't have any headaches or migraines, but I know I've worked with a naturopath, and I see Dr. Udani to help do my physicals, so to check my heart rate and to check my lungs. I know that you've been helping me with that in the past too.
Absolutely, yes. So those are some of the other concerns I do deal with. A lot of digestion issues, a lot of stress and relaxation and anxiety and allergies. Yeah, especially this like with the seasons changing. I see a lot of that.
And eczema, because I get eczema, and I've found that you've helped with that too.
Yeah, absolutely. Yeah. And I work with people of all ages, so I'm really open to seeing everyone, families, kids, teachers, everybody that kind of comes in. Yeah.
Awesome.
Okay, so for your concern today, Dr. Justine, left side of neck pain, difficult to turn your neck, and you've been doing heat and adjustments seem to be helping.
Right.
Right, okay. Are you open to doing some cupping and acupuncture today?
Yes.
Okay, great. So I'm gonna just do a little physical exam to make sure that I know the points that I need to. So right now I'm going to be doing the physical exam on Dr. Justine to make sure that I know exactly what points to use, and to also kind of see how bad her pain levels are too. So I would do this to all of my patients that come in the first visit to make sure that it's safe for them, the treatments that I'm doing, and that they feel comfortable. Okay, so Dr. Justine, I'm sorry my hands are a little cold.
That's okay.
Just let me know if you feel any pain or tightness.
Okay.
Okay, good. How are your shoulders?
Okay, so when you do get into that left side.
Left side?
Yeah.
Okay, yeah. This definitely does feel tight for me.
Yeah.
So we'll definitely do some cupping and acupuncture there.
And there, yeah. Where your thumb is. Yeah.
Oh, okay, feel that there. Okay.
Yeah. And worse so when you come lower down in the neck.
Okay. And how is my the force in my fingers?
Fine.
Yeah, it's okay. Okay, let's turn your head to the right. Okay, and then to the left. Okay, yeah, there's definitely a restriction there. Let's turn your head up and down. Okay. Okay, and then let's do like a circle movement. Yeah.
Okay, it grabs when I go
that way. Okay.
And then I'm fine.
Fine that way.
But
okay.
yeah, if I do like that motion.
Yeah, I see. Okay, so I'm thinking of doing some cupping and acupuncture in this region just to loosen those muscles out, okay? Any tightness here?
Not now, I did.
Okay, you did before.
Yeah.
Okay. So usually, if a patient comes in just for muscle work, I will do this. But let's say they come in for something like allergies or digestion issues, then I'll be listen to their digestion and listen to their lungs and the heart exam. All of those are included in my services as a naturopathic doctor. So I would basically do it for everyone that comes in with those concerns. Okay. All right. So, Dr. Justine, how do you feel that we'll do some acupuncture?
Sure.
I'm also going to have my lamp on you. So this is an infrared heating lamp. This helps with the healing process, and it's a very nice like feeling. You feel like you're at the beach with the sun, so it's going to be good for you to relax the muscles. Cool. Okay. I'm going to start our acupuncture and cupping session right now for Dr. Justine for her neck pain. So I just wanted to show you how everything is set up. So usually we have the cups here, and this is the oil that I use to kind of loosen the muscles, and these are the needles. So they all come in pre-packaged things like this, and they're single use only, and they're actually almost as thin as your hair. So they're not those big injection needles that people are a little scared of. So just wanted to clarify that. And then we also want to make sure that the skin is first sanitized so that everything is safe as possible. So I'm going to be doing that right now on Dr. Justine. So she's nice and relaxed with the heat lamp on just to help with the relaxing the muscles. Okay, so Dr. Justine, I'm just going to sanitize your neck and upper shoulder a little bit here. Are you feeling comfortable?
Mm-hmm.
Okay. So, with acupuncture, usually the sessions is about 40 minutes or so. We leave the needles on, and if a patient comes in with more pain, I do something called Electro Acupuncture. This is where it feels like a TENS machine, but you just feel more of that sensation longer on, going for longer. Okay, so come in closer so that way you can see how we do the needling. Perfect.
Is it better if my arms are down?
I think you're okay this way. I think this is the most relaxed for you for the shoulder. Good. Okay, so we're gonna be just doing the needling. And I always make sure I ask the patient first to see how they're feeling. How are you feeling, Justine?
Good.
Good. Awesome. So I'm just gonna leave it out for you for now like that. And I might do a couple more needles in and go from there to see based on her pain levels. Good. That's a good muscle release. So a lot of times that can happen, and that's completely normal. Okay, so that's just the muscle releasing. You doing okay, Dr. Justine?
Mm-hmm.
Perfect. And we might do some more points here because there was some tension here too. How do the needles feel on you?
Gentle, easy.
Perfect.
I could feel I think it was the third one, but the one close to the tip of my shoulder.
Right, you felt
Yep.
something there, right?
Yep.
Yeah. Okay.
And I can feel that one a little bit, but
little bit more.
not painful, just like a tap.
Tap, gotcha.
Yep.
So that is so you can see a little bit of redness here, so that's actually normal. That's a normal sign that we do notice with acupuncture. That means actually that the point is working, and it's really good. So I'm also going to show you Electro Acupuncture. So this is another technique that is in my toolbox that I use. So this is the machine, and are you okay if I do that on you, Dr.
Yep.
Justine? Just
Yep.
so everyone can see. So this just really helps the muscles relax even more and helps with pain relief as well. So I would not do this procedure on someone that has, let's say, a pacemaker or something. So these are some questions I would ask first to make sure that it's safe for everyone to be using, or whoever that can be using. I won't be using it on them. Okay, so we'll just do this just for a just to show. So this is how it would look, and then we just gently increase the pulsation up to Dr. Justine's, however that she can handle. So you can let me know when you start to feel it, Dr. Justine.
I don't feel anything.
Okay, I'll keep increasing it.
Oh,
there you go.
Yep.
So you can notice that the muscle slightly pulsating, so that's a good sign that we've hit the spot that needs to kind of relax. Okay. So over time, it's not a. How do you feel? Is it a
Comfortable? Yeah,
Comfortable.
it's totally comfortable.
Perfect. So we will do this for about 20-30 minutes, depending on the rest of the treatment plans I have in mind. Okay. So let's stop that. And okay. Perfect. And the needles, when we remove them, they go into a sharps container to make sure that they're safely disposed. Okay. So that is what a usual acupuncture session looks like. Awesome, so now we're gonna move on to the cupping session. So usually with my patients, I like to do a combination of these two because I feel like that just adds more, the best benefit for them. And so first I like to use a little bit of oil. So this is just olive oil, you know, no scents or anything like that because some people can be sensitive. So just get a little bit to make sure that everything is nice and slippery enough for the cups to go in. We'll do a little massage. Okay. So these are what the cups look like. So they come in different sizes, and depending on the size of the body, I might use the big ones. But for Dr. Justine, we just need to use the medium-sized ones. So if you want to come in a little bit closer, you can see how it kind of grabs on. And how do you feel, Dr. Justine?
Feels good, yeah.
Feels good? Great. So you can already see Dr. Justine's gonna bruise a little, but that's all normal. It's gonna go away in a day or two. And this is how this basically helps relieve that tension on her shoulder and her neck, okay? You can also do something called sliding cupping. This can also increase the relaxation of the shoulder muscles and so forth. Okay, so usually cupping, I do it maybe at the end of the session to relax the muscles and kind of give a lot of just a movement, increasing the movement. So you're all doing good, Dr. Justine?
Yep.
Awesome. So I'm always checking in with the patient to make sure the suction level is not too strong and that they're able to handle it. So let's say this has been about 10 minutes now. So when we remove the things, you notice some redness. So this is actually okay. We would like this because this means there's increased blood flow and circulation. Okay? And sometimes they might look like octopus, like little suctions from the octopus, but that's all normal because that's how the cupping works. Okay?
And totally comfortable.
Amazing. Yeah, a lot of patients find it so relaxing and then they just want to float home. That's what they say usually. Okay, and then usually I finish a usual pain session. Like if a patient comes in with pain, usually I finish off with a nice gentle massage and they're good to go after that. One more thing I would recommend is also nutritional advice as well, because of my experience. So for a patient such as Dr. Justine having some neck pain, I might recommend some increasing her magnesium intake or water intake and other supplements like that to help. But it would be very, very individualized to the patient. So that was a little bit of a glimpse of what a naturopathic intake with me looks like. So this is especially for physical symptoms like this. I love to work with so many other conditions, so especially any digestive issues, anxiety, sleep issues, allergies, weight, diabetes, all of and also fertility as well. So a lot of women's health I love to work with, and skin issues as well, acne, eczema. So there's a huge range right there. Then because I'm a naturopathic doctor, there is a lot that we can offer with any of those concerns. So, and I'd love to, if you do have any of these issues, I'd love to talk to you, because we do offer free 15-minute consults. So you can just have a meet and greet, chat about your concerns and what you've tried so far and all of those things, and see if we're a good match for match together to help with your concerns. And you can always reach me through email from the clinic, or you can always call reception and then book the meet and greet from there too, or online as well.